Okay, let's talk about vaccine study. Is a study which is funded by the Wellcome Trust, the Public Engagement Fund, and was conducted in two districts of Mozambique, Gile and Namaroi, in the province of Zambezi. And this study aimed at amplifying caregivers and health workers' voice and uncover new insights or solutions by using a community-based participatory research and human-centered design in Malawi and Mozambique. So the study was basically divided in three phases. The first one, which is identify. So at this phase, our caregivers, researchers were selected and hired and then trained in participatory qualitative and data collection and analysis. The second phase, which is of implementation, we conducted two human-centered designs for co-creation and also for implementing unique community-identified solutions. The third, which is the last phase, which is for the evaluation. At this phase, we'll be monitoring and measuring impact of the solutions to the process outcome. And this phase will be led by the University of Western Cape Town. So at the first phase, which was of the identification, so we came up with some drivers and the two vaccine dropouts, which were some of them power imbalance and social dynamics, reduced trust in health system, lack of social support, concern about side effects. But we also learned that generally these a compound of these barriers contribute to immunization dropouts over time. Still at this phase, we also had some specific gender considerations in data collection, such as we hired caregiver researchers who were all mothers in the two districts. They were local mothers in the two districts. And these caregiver researchers, they led all the data collection and analysis process. And also, caregivers photo voice interviews was conducted to understand the drivers. And in terms of findings, we had some specific gender findings we had, such as the communities revealed that it's a mother's responsibility to vaccinate their children. There was also concern with women's about safety concerns traveling to health facilities. Women also revealed lack of control of financial resource and transport to travel to and from the health facilities. There are also physical difficulties traveling to the health facility due to postpartum complication, pregnancy, illness linked to long distance to the health facilities. And also they reveal that uh, their understanding was that male support was desired and seen as positive. So the second phase, which is of the implementation, as I said, we conducted a human-centered design workshop and in number of two, one in each district, and we came out of this with three solutions. The first one is producing educational messages about routine immunization. At this, we are designing pictorial cards and key message for caregivers and their husbands around the importance of vaccine, side effects, how to comfort the child post-vaccination. And the second one was is designing a community and health facility collaboration structure, creating strong linkage between health facilities and communities to support immunization planning and execution by empowering both community health workers and health community workers. And lastly, we also have mobile brigade planning and execution. At this phase, we are strengthening implementation of joint planning process and execution of mobile brigades based on prioritization matrix. At this phase, we also had some specific gender consideration in designing this solution. The first one we had was that educational cards encourage support the husband, encourage support from the husband to the women in immunization of the child. At this, we are still designing this pictorial card. This is just a prototype, and the card will bring, for example, images of men actively involved in immunization. And with this, we can also raise awareness of the need of involving men in immunizing patients. Also, educational cards will directly address female caregivers' concerns and identified in the research, We are also focusing on mobile brigades to reduce challenges of distance and safety issues for women in accessing vaccines and health facilities. Then the big question is how to access if we are making then progress addressing gender inequalization. So there are three key points for ICN. One is during solution design and the prototyping workshop. We also centered female caregivers participant and got feedback on if the intervention we are designing really addresses their biggest concerns or barrier to access immunization for their children. Also, through the evaluation of evaluating the solution, uh, we have the external evaluation by the University of Western Cape Town, which will assess the impact on coverage from an equity lens and acceptability of the intervention. And lastly, we have the evaluating of community-based participatory research and the human-centered design approach. Again, the external evaluation by the University of Western Cape Town to understand how our approach to solution design, which centered female caregivers, has influenced overall project outcomes. So lastly, I'm sharing also here some links to which you can keep on learning about our study, about our implementation, but also about how caregiver research method can be. Right. And also we have a contact if you wish to know more about, you can just reach out. Thank you.